I'm sure there'll be lots of businesses who prefer not to have to avail of these types of supports. And I'm conscious they might be looking at numbers, at COVID numbers, at hospitalisation numbers, at ICU numbers, and think, things are moving in the right direction. And they'll be hopeful that they might be open again, open to the public, open to trade sooner rather than later. What is your message to people hanging on that hope?
It's a hope that I share. But with it comes a word of caution. Still more than 60 deaths recorded today, which is a very high number. And we shouldn't forget the human toll that this pandemic has had, and the fact that there are many families grieving because of the loss of a loved one. And while cases are coming down, while the numbers of people in hospital is falling fast, while the number of people in ICU is thankfully coming down, not as fast, but is coming down. And while more and more people are vaccinated every day, we're still quite far off where we'd like to be. And one of the things that sometimes goes wrong is that when people see the numbers going in the right direction, we let our guard down. And what happens is what Tony Hoolan describes, or NEFA describes, anticipatory behaviour. So people anticipate the restrictions being eased and they let their guard down and start mixing again. And then we lose the progress that we've made. And that's a concern that we'd have over the next couple of weeks. So we do need to really stick with it, at least for another month.
So at least for another month, which would bring us to the 9th of March, we'll say. I mean, the 5th of March is when the current restrictions expire unless extended. What do you expect to change in early March?
Well, the main focus at the moment is schools. Kids need their education. They need to socialise and develop, and parents are really struggling and at their wits' end in some cases with homeschooling. So that is the priority. And special schools go back on Thursday, which is really good. Special classes thereafter, and we're working on getting sixth years back, and primary schools and secondary schools. So we would anticipate that can happen across February and March. The number of new cases today is about 550. It's only one day, but last time we had figures like that, all schools were open, back in October, November and December. So we are getting into that space now where I think we can confidently say that a phased return to school can be achieved and can be achieved safely. Another area, of course, is construction. The housing crisis hasn't gone away, and we need to build houses, and we'd like to see them back on the 5th of March. But again, that's going to depend. It'll depend on where we are in terms of cases, in terms of ICU hospitalisation, and where we are at the vaccine, and what happens in Northern Ireland, which we always want to take into account. So
potentially good news for parents and for students and for the construction industry, provided things keep moving in the right direction. I suppose less good news today maybe for other sectors who were hopeful of opening up early. Some in the service industry, hairdressers and barbers in particular, who thought they might be able to open.
And again, no decision is made to either open them or not open them at this stage. But if you remember,
it's looking unlikely that we'll be able to go for a haircut on the 6th of March.
Yeah, I wouldn't book a haircut on the 6th of March, unfortunately, and we're all going to really want one by then. But if you remember the way we reopened after the first wave, which was, a pretty successful reopening, we were reopening all the way through to the end of August when we had to start reimposing restrictions again. And, the kind of things that were done initially there was, outdoor, because outdoor is much safer. So allowing people maybe to meet other people outdoors, the golf, outdoor retail, that type of thing. I think you're much more likely to see that being allowed than personal services, which is up close and personal and tends to be indoors, and therefore is at a slightly higher risk, notwithstanding all the amazing work that people who run those businesses did to make their businesses safe.
Well, when you say outdoor meeting up of people, do you mean a household visit in a back garden to see Granny and Grandad again? Is that the type of outdoor meeting you're talking about?
Yeah, look, I understand the line of questioning, and I understand you want me to give you a straight answer, but I can't because that's not a judgment call that we can make at this stage. It's one that we'd be making on foot of public health advice really at the end of this month. And
no, I appreciate it. I'm not asking you to tell us what will happen, but you volunteered outdoor meetings yourself as something that might happen, and I just want to get an idea, because you can meet someone outdoors, say for exercise, from one other household. as I understand at the moment, as long as you're, you maintain your distance and wear a mask and all of that. So when you talk about some relaxation around households, what did you mean by that?
You know that the potential of two households meeting in a garden or meeting in a public park, or potentially, elements of outdoor exercise that aren't allowed at the moment. Like for example golf, like for example underage teams, doing some form of training. The kind of things that you would see in level 4 of the existing plan.
Okay, you mentioned the existing plan and level 4. I understand we will have a new Living with COVID plan. Is that right?
Not new, but it'll be a refresh of the existing plan. So, when that plan was agreed, can't remember exactly when now, I think it was July or August last year. It was before we had any vaccines. We now have 3, and it was before we had this whole issue of variants of concern. So a lot has changed since then, and we think it's appropriate to refresh that plan. So that work is ongoing at the moment.
And what I'm not going to ask you exactly what is going to be in that plan. You won't tell me. You don't know yet, and I appreciate that. But what will inform that plan? Is caution going to be the order of the day?
I think short answer is yes. As the teacher said today, the approach is going to be cautious and conservative. I don't think anybody in the country wants to see us open up as quickly as we did back in early December, because particularly with the B117 variant, there's a risk that cases could take off very quickly again. So the kind of reopening that you might see is something more like you would have seen last May or June after the first wave, a bit more cautious, so that if it goes wrong, we can act quickly. We don't want to have a situation whereby the horse is bolted before people hear the door slam.